Now the recording has started and I'll share my screen. So now I'll welcome you all in today's class, and we are going to discuss about the assignment discussion for the unit 2, which is supporting individuals in adult social care. And as with the other assignments, we have discussed earlier that every unit has 4 learning outcomes. So we have the same in this unit as well, and we need to complete the assessments. Like first of all, I would like to discuss you, or uh, I would like to tell you what is the meaning of an assignment or assessment. Then we'll discuss about the assignment brief which we have, and then I'll show you how to search from the internet, and if we are looking to uh, do the work, so how do we search the work and paraphrase it, and then we need to do the in-text citation and referencing. And for example, in the meanwhile, if you have any question, then please do ask me and I'll try my best to answer those questions. So um, as you all know that this is the course is for the uh, diploma in health and social care, that is for the ATHE level 4, and now we are discussing about the unit 2. So first we'll like do a quick review for all the important aspects which we have discussed in the unit 2. So we discuss a few of the important points, like first we'll go through with the learning outcome 1. In the learning outcome 1, we discussed about the effective communication, and we discuss about the verbal communication, non-verbal communication, written communication. We also discuss active listening, empathy, and respect. And these all are the important aspects for the um, verbal, for the communication. These all are the essentials in communication. We discuss all of them. Then we discuss about the personal care task. Um, Personal care tasks involve assisting individual with activities of daily living, such as bathing, dressing, grooming, and toileting. So we discuss everything about that. That how do we assess? How do we assist the service users? We discuss about communication techniques. Uh, we have discussed about the medication management, safeguarding procedures. Again, safeguarding is very important in health and social care. So we also discuss about the person-centered care approaches. Person-centered care approach is again very important in overall health and social care, and it doesn't matter that it's for adult or it's for children. So, but overall, we apply the person-centered approaches, and then in the learning outcome 1, we discuss about the uh, models of communication, and which is related to the health and social care context, and uh, these are all the important aspects. Then methods of communication we discuss, like the verbal, non-verbal, written, electronic, and etc. We have discussed about these. um, Also, uh, we discuss about some of the barriers, like there could be a language barrier. So we use the um, uh, we overcome it by using translator or visual aids. We discuss about it. Then few of the important aspect was active listening. We discuss about the assistive technology, and assistive technology is like these days mm, very important in health and social care. So we could use it in communication. For example, hearing aids improve the auditory input for those with hearing impairments, and uh, we discuss about the interpreters. Interpreters help bridge the language gap between the service user and healthcare providers, ensuring that accurate and full communication occurs despite language differences. Then we discuss about the picture exchange communication system, PECS. So visual communication involve using visual aids to enhance understanding. PECS uses pictures to help individual communicate without speech by handing over pictures for everyday needs and feelings. So we discuss about that. Then advocacy is important in communication. So advocacy in communication, it means like speaking up for service user who may be unable to express their needs or rights, ensuring that they receive appropriate care and services. Then we discuss about the uh, regulatory side of communication. So, for example, it includes like importance of record keeping and use of ICT, and we have discussed one of the important aspects is feedback. So like in studies also, students get the feedback from the tutors, whether it's a formative or summative feedback. So same way we get the feedback from the service user in health and social care industry. And with that, what we do is we adjust our communication techniques or practices according to the feedback provided by the service users. Another important aspect is consent. So consent ensures that the service user agrees to the care provided and understand what it entails, and respecting their rights and autonomy. So records should be accurate, up to date, factual, stored securely to protect the confidentiality of service user. So we also use the in recording, we use the GDPR and Data Protection Act. And if we don't follow the uh, legal procedures, then there could be consequences. For example, legal action, loss of trust from a service user, and potentially harmful mistake in patient care could happen if uh, we don't follow the procedures and the policies properly. Uh, then there were important aspects in the unit in the learning outcome. One was uh, we also discuss about trust, that it's important to build trust between caregivers and service user, because it ensures that care is provided according to individual preferences and needs and supports the well-being and dignity of person. Then we discuss about the use of some visual aids and things. Then we have to we also discuss about the facilitating the understanding, effective communication that ensures information is conveyed uh, accurately and comprehensively, and promoting mutual understanding between the service user and care providers. Then one of the important aspect was building trust and rapport, empowerment and involvement. We also discuss in that learning outcome uh, tailoring communication methods, and we need to adopt communication methods that those are essential to ensure the service user can receive and understand information effectively regardless of their abilities or communication style. What it does, it helps in making sure everyone is on the same page. Then we also discuss about respecting the confidentiality and privacy, seeking feedback and clarification in the learning outcome one. uh, Cultural competency and sensitivity is also important. We discussed it that in learning outcome one. So cultural competency and sensitivity help care providers understand and respect the diverse background, beliefs, and values of service users. So by doing so, providers can avoid misunderstanding and effective communication to meet the unique needs of each individual. And few of the important like rules and regulation or laws were we discussed um, in the UK, like Health and Social Care Act 2008, regulated activities and regulation 2014. um, these set out specific requirements for record keeping and reporting in social care setting, health and social care setting, to ensure compliance with legal standards and quality. We also discuss about the GDPR and Data Protection Act as well. Then we discuss about the um, consistent policies and procedures. These are vital for maintaining transparency and ensuring that all staff members are aligned in their documentation process. So, um, and few of the bits like examples of information that could be documented. We discuss about um, information such as service user assessment, care plans, medication administration record, incident reports, and any changes in service user condition or preferences that are commonly documented to ensure comprehensive and effective care delivery. We discuss about these. Timely record keeping is important also. It enables swift intervention and prevents potential risk and ensure that appropriate measures are taken promptly to address any issue or changes in the service user condition or care needs. Uh, then we discuss about the what we have discussed in that as well. We also discuss about some of the mm, uh, key principles related to accuracy uh, and confidentiality and communication, record keeping, and reporting in adult social care. Um, we also discuss about effective communication and collaboration. What it does, it ensures that relevant information is accurately documented and shared among care team members, and interdisciplinary or multidisciplinary communication supports holistic care planning and coordination of services, leading to improved outcomes and quality of care. We also discuss about the training or the CPD activities. These are important in health and social care. Then we discuss about the ethical principles. Ethical principles provide a framework for balancing the various factors involving in determining best interest. And we discuss about the legal frameworks such as Mental Capacity Act in the UK, and we discuss about prioritizing and we need to promote the service user well-being and without harming them. And we discuss about some of the examples as well. Like for instance, we discuss if a service user with dementia had previously expressed a strong preference for home care over a residential facility. So decisions made in their best interest should prioritize maintaining their autonomy by exploring home care options, and by this promoting their well-being and dignity. Uh, we also discuss about court decision and precedents serve as a way to establish clarity and consistency in interpreting and applying the best interest and standards, especially in complex or continuous cases. sometimes we do need to involve the court cases if you find out that the mental capacity is not a person is suffering from a mental issue. Then in the unit one, in the unit two, the learning outcome one, these all were the important points which we discussed. So I'll discuss now about the learning outcome two. So in the learning outcome two, we discuss about the concept of person-centered and personalized care in adult social care. So uh, now the person-centered care focuses on tailoring care to the individual unique needs, preferences, and values, treating them as an active participant in their care. And why it is important, so we discuss about that. So considering an individual background and experiences helps in creating care plans that relate with their life story, promoting a sense of familiarity and comfort in care delivery. We discuss about empowering the service users. We discuss about person-centered and personalized care, um, principles and practice of person-centered care, person-centered assessment and planning, person-centered thinking tools, holistic planning. Nowadays, holistic planning is very important in health and social care. We also discuss about that. We discuss about the active participation and independence of and which give benefits to the service users. Mm, Assistive living technologies we discuss in the learning outcome one and also in learning outcome two as well. Uh, Then we discuss about principles of person-centered care. In that we had individualization, we have empathy and compassion. We discuss about collaboration. We discuss about the person-centered care. In person-centered care, we discuss about building relationships, flexible care plans. We discuss about continuous evaluation of ourselves, and we discussed about the individuality and autonomy. So person-centered care fundamentally resolves around the acknowledgement of each individual unique identity, preferences, and experiences. So we discuss about that holistic approach. I say that that's important. So now in health and social care, we always follow the holistic approach, uh, which is based on the person-centered care approach as well. So person-centered care adopts a comprehensive view that has not only the physical health of an individual, but also consider their emotional, social, and spiritual well-being. We discussed about the respect and dignity. We discuss about the assessment and planning that is important in health and social care, communication and information sharing. Again, this is related with the whole unit. Um, then we discuss about the continuity of care. If you guys remember that in person-centered care, continuity and consistency in care delivery are fundamental for providing individual with a seamless and integrated care experience. We discussed different scenarios as well. Uh, so if in the assessment criteria, we are required to give some example, then we can give some examples from our workplace. And we discuss about the flexible delivery models. We have discussed about the continuous monitoring and review process, individualized care planning, coordinated care delivery. Uh, we discuss about outcomes of monitoring and evaluation, and these are important aspects because a key aspect of personalized care is ongoing monitoring of outcomes and evaluating the effectiveness of intervention in achieving the individual's goals. Um, we also discuss about resource allocation, data privacy and security. We discussed about the training and education for staff. It is like very important, offering ongoing training and education programs for staff on person-centered care practices can improve the culture of care. and regular training helps the staff understand the importance of individualized care and equips them with necessary skills to engage with service users effectively. We also discuss about the leadership and role modeling that is important in the learning outcome to regular audits and quality assurance. uh, we also discuss about the evaluation. So strong leadership is committed to person-centered care and is vital in shaping the organization culture and ensuring that care practices align with the needs of service users. And the leaders who embody values such as empathy, respect, and collaboration set the foundation for a person-centered approach to care delivery. Um, so we also discuss about ongoing professional development. We discuss about co-designing care plans like with the interdisciplinary or multidisciplinary team. So these all are the important aspects which we discuss in the learning outcome 2. Now we will see about learning outcome 3. So as I said earlier that every unit has 4 learning outcomes. In the learning outcome 3, we discuss about the safe and effective practices and in supporting individual well-being and maintaining a high standard of care. So we discuss about the risk assessment that is important in this unit in the learning outcome 3. So what was risk assessment? Risk assessment was conducting comprehensive risk assessment is essential to identify some potential hazards, and we also assess the individual needs and implement appropriate safety measures. This helps in preventing accidents, minimizing risk, and ensuring a safe environment for individuals receiving care. We discuss about the safeguarding vulnerable adults, infection control, medication management, health and safety. So health and safety again is very important. So adhering to health and safety protocols that include, for example, fire safety procedures, risk assessment, and safe manual handling practices. These all are crucial to maintaining a safe environment for individual and staff members, and regular health and safety training and audits help mitigate risk and ensure compliance with regulations. So we also discussed about the physical hazards, health and safety risk, safeguarding risk, environmental risk. Then uh, we have some strategies which could like lessen these hazards. We also discussed about the examples like we discuss, for example, if we talk about the safeguarding and incident reporting. So the example could be, um, we can consider a scenario where a care worker notices bruises on a service user during a routine visit. Then this observation raises concern about potential abuse or harm. So in this case, the care worker must follow safeguarding procedures by promptly reporting the incident to the appropriate authorities or designated safeguarding officers. Uh, we also discussed about infection control measures, like we had the COVID incident before. So in that time, we used the PPE, the personal protective equipment we use a lot, and then we also discussed in that learning outcome 3 emergency preparedness. So what it has, like evaluating emergency preparedness plans involve assisting the protocols and procedures in place to respond effectively to emergencies and critical incidents within adult social care setting. This includes reviewing plans for evacuation procedures, first aid responses, emergency medical care access, and communication strategies during emergencies. We discussed few of these bits as well. Then we had in the learning outcome 3, um, clear policies and procedures. We discuss about risk assessment and management. We had open communication strategies, and if we use that, like utilizing open communication strategies and considering mediation and advocacy. These approaches can effectively address conflicts in adult social care settings. We discuss about those. Then we had uh, in the learning outcome 3, we discuss about mostly the addressing the conflicts or dilemmas between individual rights and the duty of care in adult social care setting. So this necessitates a balanced approach that honors the autonomy and choice of service user while prioritizing their safety and well-being by embracing person-centered approaches, clear policies and procedures, collaborative decision making, open communication, and mediation or advocacy services. So, along with providing staff training and adhering to legal and ethical principles, conflicts can be navigated through thoughtfully and effectively while upholding the duty of care. So, we discussed these important aspects in the learning outcome 3. Then we will do a quick review for the learning outcome 4. In the learning outcome 4, we discuss about understanding professional practices in adult social care involves various aspects that aimed at supporting individual in a holistic and comprehensive manner. So we had again the whole unit has person-centered care approach, ethical and legal compliance. So we discussed the effective communication, personal profession development, multidisciplinary collaboration, um, ethical and legal frameworks. We had communication skills. We also discussed about the uh, continuous profession development, CPD trainings. We had in the learning outcome 4, we discuss about professional practices in adult social care is multifaceted, and it requires practitioners to various essential components of delivery, uh, it will enhance the high quality care and support. And we also follow the ethical and legal frameworks. We discuss about that. Then we had in learning outcome 4 risk identification and assessment. So like previously we gave the example of a person who was like suffering from some bruises, something like that. So how do we do the safeguarding, and like overall we discuss in the learning outcome 4 that the collaborative efforts and shared commitment of professionals involved in multi-agency working are essential in safeguarding and protecting vulnerable individuals in adult social care setting. And by utilizing expertise, resources, and perspective from diverse agencies and disciplines, multi-agency working enhances work assessment. Um, um, like uh, if you work together, then what will happen that risk assessment, intervention, and overall care practices uh, will be improved. So we discussed all these important aspects in this unit. So we have gone through uh, the important aspects which we discussed in the unit 2, including all the learning outcomes from learning outcome 1 to 4. So now we will look at the assignment uh, brief. So this is the assignment brief we have. So now, for example, here they have given us a scenario. So we in a scenario you have to think like that you have been employed by a provider of adult social care in your chosen country. So in our case it would be Kingdom, the UK, and you need to develop your knowledge and skills in relation to ensure your role. And as part of your development you need to produce a number of written documents that evidence your knowledge. So we have to think that we are employed in United Kingdom, and now we need to produce some documents. So this is the task one. So in that task one, we have that scenario is like that your manager has asked you to produce a presentation about communication in adult social care. So we need to prepare a presentation. You should include practical tips for making communication accessible as well as underpinning knowledge about communication, and we need to produce slides and complying uh, speaker notes. So we need to create speaker notes as well. So these all are the important keywords here. So then your slides and speaker notes must analyze the importance of effective communication and how this can be applied in practice to meet the need of service user, and this should include an explanation of the different types of communication and their uses and need to gain consent. Then the second bullet point which we need to discuss is we need to assess the requirements for record keeping and reporting in adult social care. So as you all know that we discuss about many things in these two bullet points, like verbal communication, non-verbal communication. So we need to give explanation and examples and types of communication. So and also consent. We also discuss all these important aspects and we review them today as well. Then requirements for record keeping in reporting in adult social care. So for example, I told you that I'll try to explain few of the bits how we could find the content from the internet as well. So now there are two important aspects in doing an assignment. These are the command verbs. So we always use the same command verb. For example, this analyze. So we always need to use the same word. We need to analyze. Then the important aspects are in finding the important points. So we look for the important keywords. So for example, here if I see it as in terms of a student, then effective communication, the importance of effective communication, I believe is important. Then how this can be applied in practice to meet needs of, so we need to discuss about the needs of service users, so how it meet the needs of service user. Then explanation of different types of communication. So it says different types, so it should be more than one. If we only say that, for example, verbal communication, so it's only one type, so that won't fulfill the criteria properly. So we need to discuss about different types. So it could involve again verbal, non-verbal, written, some electronic communication, different aspects we can discuss here. So make sure that there is different types, so it should be more than one. Then their uses and need to gain consent. About we need to discuss about consent. Then for record keeping and reporting in adult social care, we need to discuss about the for adult requirements for record keeping and reporting in adult social care. So these all are the important aspects. For example, I told you that I'll show you an example. So for example, if I think that this is the important keyword, then I'll copy it and like to, we have like different options here. We can look out for from the internet as well. For example, if we go to, we can search it in Google Scholar. So if we search it in Google Scholar, we'll go to Google Scholar and make sure that it should be on selected as an articles. So we will paste it here. Importance of effective communication in what? So we are talking about in health and social care. So So we will find out some papers related with importance of effective communication in health and social care. So look, this is one of the content we got from the importance of effective communication in healthcare practices. So we can get the information from here. Then we can also look for, uh, we'll read this, we'll rewrite it in our own words. Then also we can copy it. If we simply use Google, for example, then we can paste it here. Then we will always look for the reliable sources. We won't look the information in the Wikipedia or any non-reliable source. So for example, this is from NHS.UK, so that is a reliable source. So I can go on to that and gather the information. For example, this part is selected, so I think that this is also important, but it always not necessary that whatever is like um, highlighted in the text form, that is reliable, like, or this information is useful in my assignment. It's not always necessary, so we need to read the content properly. And just for example, if I think that these are the important points which I need to include in my assignment, so I will copy these and I will rewrite in my own words. I won't just copy paste it exactly. And if I copy paste it, then it would be a pleasurized work. So we always gather the information from the internet or any sources, any good reliable source. Then we will write it in our own words, and we do need to provide an in-text citation and the reference for that. And we always use the Harvard referencing style. So we will write it in our own words, then we will provide the in-text citation, and in the end we will provide the reference. And in Harvard referencing style, we do it in alphabetical order. So uh, this is important. And also also we can look for some books. So here are some option for books. If you go on to some books, you could find some books here, and also you have it in your library. In the slides, we have those references. We have some recommendation for the books, so we can follow those books and resources as well. So we can read from different books, articles, journals, uh, internet sources, and even we can use slides or learning materials from the college. We can use some YouTube videos as well, but we do need to give the reference, or the TED Talks. We can use these bits as well, but we need to give the proper in-text citation and references as well, and make sure that it relates to the assignment criteria and the important keywords and the topic related with it. So these all are the uh, important aspects which we can use in completing our assignment. Then, like for example, in this one, we have uh, they are discussing about that to achieve a merit, we need to evaluate. So again, now here the command verb is this, so we need to use the same. We need to evaluate it. We need to evaluate the application of best interest in cases where service users are unable to consent. So for example, in best interest of in cases where service users are unable to consent. So what is important in that? So mental capacity act is important in that. We need to discuss about that, and we need to like give a proper answer to get a merit. And then we have the task 2. So in task 2, what we have, you have been asked to prepare a handbook about person-centered and personalized care and professional practice and partnership working in adult social care. So you should illustrate the points made with example. Your handbook must. So in task 2, we have a handbook. So it means that is a written work. So we need to analyze the principles and practice of person-centered care. We need to analyze the principles and practice of person-centered care. So we have gone through all of these important aspects, the principles and practice of person-centered care and the principles and practice uh, of personalized care. So we need to discuss this, and it would be a written work in the form of a handbook. Then we have we have a distinction activity related with it. So if we complete it, so first important bit is we always need to work on the pass criteria. We always have to achieve it. Then after that, we will go for the merit and the distinction criteria. So first complete the pass criteria properly, then go for the merit, and then go for the distinction criteria. So in distinction criteria, we have to evaluate ways to promote uh, and maintain a culture where practice is centered on the needs of the service user. So now look here, it's saying ways. This is important. It's not a way. So it should be more than one. So sometimes students make this mistake. They always most of the time what they do is they think that only giving a one example or one way that should be fine, but look at here, it says that ways, so there's an s in the end, so it would be more than one. It's a plural. So then we have the task 3. uh, then in task 3, prepare a case study. We need to prepare a case study that analyzes the care of an individual, of an adult social care user, and explaining the underpinning elements and theories and how they impact on the individual. So look, elements and theories. Again, these two are plural, so it should be more than one. So we need to discuss about the elements and theories. Um, your case study may be fictitious or may be based on real individual. So it should be a fictitious or based on real individual. And do make sure that if we are using a real individual, then it should be anonymous. We cannot give details of a service user. It's against the Data Protection Act and the GDPR. So make sure that if we are giving a real life example from our workplace, so we won't use their actual details. So if using a real case, you should ensure that, oh yes, they have mentioned that your name and personal details are changed to protect confidentiality. So then we need to discuss these two important bullet points. We need to analyze components. Again, there is S in the end, so it would be more than one. Professional practice in adult social care. Then we need to analyze the principles and practice of partnership working in person-centered care. So again, we have S in the end here, so it would be more than one principles and practices. So this is with the learning outcome 3. Sorry, this is would be the task 3. Then we have the task 4. In the task 4, we have your manager has requested that you produce an academic poster about safe practices in adult social care. So your academic poster must, so we need to make a poster. Uh, what includes in a poster generally, what we have in that, we always have some images in that. We have text as well as images in a poster. So for example, if it's a written content, then we can use Microsoft Word and we will type the assignment. But if we have a poster, generally we see the poster on the walls or on the shops, then what they have some images and also the content. So because the criteria is asking us to make a poster, so make sure that we make a poster. It's not necessary that we will make it properly by the help of any graphic designer. So like we can do it in the Microsoft Word as well. We will write the content, and we will add some images uh, related with the safe practice in adult and social care. So your academic poster must explain the management of risk in adult social care. So we need to explain the management of risk in adult social care and analyze safe practice in adult social care. Then we have some extension activities related with it, that is merit and distinction criteria. So if we always, I encourage all of you to follow, also attempt the merit and distinction criteria as well, and try to achieve it. First, you need to complete the passing criteria, and you must have to achieve it. Don't miss any important keywords or command verbs in your assignment. Make sure that if it's asking for a single make sure that you read it properly, the bullet points. For example, if asking for a multiple case studies or multiple examples, then we need to provide it. Make sure that if it's written that is an example, an example, so that means a single example would be enough. Then if it's saying examples, then we have to give more than one example. uh, so we need to read the important aspects, and for example, in this case we need to uh, attempt the merit criteria, and for that we need to discuss how conflicts or dilemmas. So again, both has s in the end, so there should be more than one. So and the duty of care might be addressed, and try not to use many bullet points in your assignment. Try to write it in a written format in paragraphs. uh, but in some cases where it is necessary, that if we need to discuss some uh, points, then we can use some bullet points, but not the whole assignment should be based on bullet points. It should be written work. So then if we want to attempt and achieve the distinction, so the your academic poster must also assess how multi-agency working supports protection of vulnerable individual. So we have discussed about that in the whole unit, the multi-agency working, the uh, interdisciplinary or the multidisciplinary working. So we need to give examples, and we need to write about that working supports protection, uh, multi-agency working supports protection of vulnerable individuals. So we need to discuss all these, and then we have learning outcome and assessment criteria. We have these learning outcome 3 and 4 covered. Then right. So these are the guidelines for the assessors, and also it will also guide the students as well. That again, if you see that few of these command verbs are in bold, so that means that you have to analyze it properly. And here the command verb is evaluate, so make sure we use the same command verb, and we do the analyzation or the evaluation of the given criteria. And so these all are the important aspects for your assignment. And also we had uh, So we have guidelines for the unit 2. So for the pass criteria, we have to analyze the importance of effective communication and how this can be applied in practice to meet the needs of service user. We have to do the 1.1, 1.2. Then we will go for the merit criteria. Then we'll go for the 2.1 activity. Then 2.2. Then we will go for the distinction criteria. Then we have to discuss about this 3.1, 3.2. Uh, then we will go for the merit criteria, because all these are related with activity 3. So we'll go in a sequence, and then we'll go for the fourth activity, that is the 4.1, 4.2. Then we will go for the 4D1 distinction criteria. So make sure that we follow the structure properly, and there are like few important aspects in writing assignment that we always try to it's not like necessary, but always like we recommend that a student should always try to use the font Arial size 12, and the line space should be 1.5. So uh, these point we should always remember. Then look, these are the indicative content for the whole assignment, for the whole unit. So again, these bullet points are important, so keep in mind all these indicative content. uh, Look, we have 4 learning outcomes, so four uh, we have four different indicative content related with each learning outcome, and reviewed we review these again in today's lecture as well. Like for example, in learning outcome 1, we have methods of communication, verbal. So in verbal, we have face-to-face, telephone, video conferencing, non-verbal, written. So we discussed these today as well, but we have discussed everything in detail in the lectures related with each learning outcome. So for example, we also discussed today picture exchange communication, PEC, as today, and we discussed properly in the lectures. So in the learning outcome 2, we have what person-centered and personalized care and why they are important benefits for service user. We review them today and also in the proper lecture. Then in learning outcome 3, for example, we have risk assessment, managing risk, dilemmas, conflicts, infection control processes. Then understand in this learning outcome 4, we have understand professional practice in adult social care, role of professional bodies in relation to adult social care workers. Then a code of practices in UK, code of conduct for healthcare support workers and adult social care worker in England. We can get the information from this link as well. Then we discuss about all of those bullet points in our lectures, and we review few of them today as well. Then we have mm, okay. So again, these all are linked with unit 13. Uh, this is learning outcome 2 is linked with unit 13. learning outcome 4 and assessment 4.2. It also linked with unit 14. This learning outcome 3 is related with unit 18 as well. So this is just for information purposes that it's related with these units as well. Then we have some suggested resources. So make sure that we do read these resources. So in the form of text, we have this, then the web resources, we have this, then global context. If we are giving examples from an international perspective, then we can use resources like World Health Organization. Then general text, we have these books or the resources. So we can gather information from multiple sources, and we will be able to complete our assignment. uh, and again, make sure that you always like give proper credit to the authors. We need to do the in-text citation and referencing, which is Harvard referencing, and I believe these all are the important points related with the assignment. And if any one of you have any question, please do ask, and I'll try to answer, because we always try to get the assignment done properly in the first go. Then um, we won't be capped at pass. So if we like got a referral, we got referred in any assignment, then the second time when we submit the assignment, we always like get a capped at pass. So no matter if we have achieved a merit or distinction grade, then we will be capped at pass. So it's best for us to do the best work, provide the best work to the assessor in the first attempt, and then we can get the merit and distinction as well. But again, keep in mind that we must have to achieve the passing criteria. Then we will go for the merit or the distinction criteria. If we only like attempt the merit criteria and we think that, or the distinction criteria, and we think that we will get the pass grade automatically, no, that's not correct. We need to achieve the passing criteria first, then we'll go for the merit and the distinction criteria. Again, I ask from all of you that if you have any question, then please ask, and any question or any confusion related with the assignment, and I'll answer that. Make sure that we read the scenario. Scenario again is not a question. That is a scenario. On the basis of that, we need to think, um, like in the like HNC, or in HNC, we are always like to think as a care worker. So like in higher levels, like for the HND or the um, honors level or the graduation level, for example level 6, then uh, we use example as a manager. So scenarios are not the question, these are the scenarios that how we need to think about it, how we need to write the assignment. Look here, that's in task 1, that our manager has asked you to produce a presentation. So that means we are not the manager, we are the care worker or healthcare assistant. So we will like to, we will need to write as a healthcare assistant. Any questions, student? No. Okay, so if there's no question for today's session, then we'll finish today's lecture on the assignment discussion. So I wish you all best of luck for the assignment and the assessment, and please complete it in time and like follow my instructions, and hopefully you will get a better grade. So I'll see you with the next unit, and till then, all of you please take care. Bye. I'll stop the recording. Bye everyone.